histrionic personality disorder, and these are really two sides of the same coin. They belong to the same cluster. We call these clusters. It's a way to organize personality disorders in that DSM. And this cluster is described as the personality disorders that are dramatic, erratic, and emotional. Okay, so unpredictable, but really having to do with emotions and relationships. They're very similar. Whereas I was saying that borderline personality disorder, a lot of the key features that you're going to notice are instability. When it comes to histrionic, a lot of the key features are going to be drama and shallowness. Similarly, with borderline personality disorder, there's this underlying drive of avoiding abandonment. With histrionic personality disorder, that underlying drive is to always be the center of attention. Because if you don't have that attention on you, it feels similarly to borderline personality disorder. You feel pretty empty, like you don't have that sense of being or of value, okay? So whereas borderline personality disorder might have more of the visible reactivity if somebody seems to be leaving, with histrionic personality disorder, what you're going to see is extreme discomfort with not being the center of attention, extreme efforts to be the center of attention, and when they feel that they're not the center of attention, you will see some strange things, making up stories to try to get attention, often taking on a victim or princess role. Those two roles in particular are pretty consistent. Seeking caretaking. Borderline personality disorder is similar because with borderline personality disorder, these shifts of identity and the splitting, you might see somebody go from being, in the DSM it describes it as a needy supplicant of help, seeking the perfect caretaker, to suddenly being the avenger against injustice or thinking that their partner is a terrible person. With histrionic, what you'll see is somebody who wants to be the center of attention, has sort of that impressionistic speech, very flowery, very enthusiastic, but nothing's really being said. The moment your attention wears away, because they're so demanding for attention, that's when they might take the victim role or the princess role and even make up stories. Sometimes those stories are to bolster the victim role. Sometimes those stories are just to make them look more interesting or accomplished in their mind so that they can get respect and attention that way.
Is there a relation between histrionic personality disorder and attractiveness?
There is, strangely, and this is always one of the trickiest things to talk about because how is that a symptom? But characteristically, people with this disorder are very, very interested in looks, but more importantly, they utilize their looks to get that attention, to get that respect that they're seeking. And so this type of anybody, characteristically, they actually couldn't even be subtly, and when I say flirtatious, I'm not talking overtly sexy, but kind of inappropriately flattering. Sometimes they act in a kind of a girlish way to be cute and to engender attention. And this will even occur in their therapy relationships as a way to sort of avoid getting negative feedback or criticism. Oftentimes they'll bring the therapist gifts or be distracting if they engage in therapy because they just don't want any criticism. They want the therapist to like them.
Does the intelligence of the affected person bear on the manner in which these disorders present?
Excuse me, I choked a little bit water. Yes, and I think one way to think about it that's probably a little more accurate than just intelligence is, in psychology, we would describe this more as sophistication. So street smart, so to speak. The way, for instance, I've had many clients who have borderline personality disorder who are messy and really clearly suffering, and they might be difficult and all over the place and yell at you in the middle of a session, but it's so, it's not tailored. It's so much easier to work with because of that just openness and rawness of it, genuineness. sometimes you'll have a more sophisticated presentation. There are 9 symptoms and only 5 have to be met. So there are a lot of different combinations and different ways it can present. And sometimes you'll have more of a petulant version of this, where it really shows when you push the button and you're kind of, whoa, what was that? So somebody who's really productive, high functioning, successful, and you get to know them and you think they're fantastic because they're so interested in you too. And you might not realize it, but they're mimicking you perfectly. So you're really just kind of falling in love with this new friend who is being you. But then all of a sudden, you say something that they think is offensive, and you can't, even in your wildest thoughts, understand how that could have offended somebody, but their reaction is so strong that you kind of buy into it. Gosh, maybe I did say something offensive, and you feel bad about it. So that sophisticated version, they can be a little bit more calculated in the way they present. They tend to kind of hit you where it hurts a little bit more, and they can be actually very, very destructive.
What conclusions were you able to draw about Ms. Hurd's sophistication from her testing?
Well, from her testing and from her presentation, she was very likable, but her testing in particular showed that she approached it in a manner that, remember I told you about those scales that are pretty neat. She approached it in a manner that very clearly minimized any psychological dysfunction, not just that, but really presented herself as free of any problems. And she did so in a way that was very, very sophisticated, not obvious, by responding to questions that most people might not notice were trying to detect that.
How did you determine that?
So that's based on a particular scale on the MMPI-2 that is designed specifically to detect a type of responding that's a little bit more clever, a little bit more sophisticated, minimizing problems in a way that most lay people probably wouldn't understand, and even providers, very difficult to detect.
You mentioned that one of the characteristics of borderline personality disorder is emotional reactivity. How might that present in an intimate relationship?
So I think it probably presents mostly, or you'd see the bulk of it in intimate relationships because of that regular interaction and the desire for your partner to meet all of your needs, to be the perfect caretaker. Also that the hallmark of the disorder with the splitting, so idealizing, devaluing, and the perceiving of all sorts of neutral events as somehow demeaning or disrespectful. It's regular escalations of anger, frustrated complaints, criticisms of your partner. But because the person with borderline personality disorder, first of all, they're more sensitive to things, they feel distress more strongly, and then that distress lasts longer. So these types of blow-ups go on forever, and they're very cyclic. It feels like you just can't get a resolution, and eventually the partner will try to leave, will want to leave to take a break. It wears them down, and that's when the borderline might explode and act very aggressively or violently to try to prevent them from leaving.